Hello everyone. Today I am going to be presenting on the New Jersey Eldercare planning process. And this is for anyone who is working in the field with a senior or a family member who is assisting a senior on planning the eldercare process, or for someone who's working with a consultant in eldercare planning and needs some additional information and guideline that will assist them throughout the process in knowing what questions to ask. So I started my career working at a nursing home. Then I transitioned to work at an inpatient hospital in Bergen County, where I transitioned to working outpatient in a geriatric facility. And I also work with a number of veterans, so I'll be presenting on some information about veteran services and how to utilize the primary care service team for our veterans. So as I mentioned before, this course is going to provide a guideline and an introduction to the elder care planning, and it will have questions and answers about what's to look for when you have an aging senior in your home, or you're caring for an aging senior, or if you're approaching age 50 to 55, what are some of the things that you need to have in place so that whenever the time comes where you are going to need certain services, that you already have the plan set in place for these services. A lot of questions that I normally get working with seniors and their family is, why is elder care planning important? So it's very important to know that when you plan ahead, you avoid certain pitfalls. For example, a lot of families always ask, but my mom has Medicare, but what they do not understand is Medicare does not cover auxiliary services that their family may need, such as home care services, which is covered under different type of insurance and may need different type of payment method. So Medicare will cover home care services, which I will explain further in the presentation, but it has to be skilled services. So avoiding common pitfalls, financial stability. So when you plan ahead, you pay less upfront and you pay less out of pocket. And it provides you with adequate care. Say, for example, if you're living out of state and your mom is living in New Jersey, you may hire a consultant, and that person can plan ahead of time and anticipate the services that mom or dad may need. And they also could provide care management services, which are services that they will visit nursing home on your behalf, visit adult daycare centers to make sure those places are appropriate for your mom's or dad's need. And also this course will also help you to understand the different coverages: veteran, VA, and attendant services, long-term care insurances, Medicare, Medicaid, the quality income trust account, and so forth. And it also helped to reduce caregiver stress. I cannot tell you the amount of times when I worked in outpatient and I see a family member come, oh, my mom is sick. She was walking yesterday. She fell. Now she's bed bound. What am I going to do? I didn't plan for this because I did not expect it. So planning ahead of time, I'm not saying you could plan for everything, but planning ahead of time, like, making sure the person, have an insurance, long-term care insurance in the event that something happened and they may need long-term care services, making sure that, when they need managed long-term care services, that they have the right accounts and the right services in place. And also, overall, it saves money because if you plan ahead of time, as I mentioned before, it reduces the immediate out-of-pocket costs. An elder care plan is basically a plan that helps elders, their family, to plan ahead of time so that that adult may enjoy a healthy life, whether it may reduces the stress of immediate planning, and it encompasses a lot of things. A long-term care planning, maybe it could be if a senior wants to live at home, which we normally call aging in place. It doesn't have to do with always have to do with nursing home placement. It could be that a senior wishes to live at home, and those type of wishes needs plan in place. For example, if mom is sick and she's fragile and she may needs and she wants to live at home, you have to have things in place and plan in place for her to live at home. So this is a part of the plan where we talk about elder care planning, and sometimes we interchangeably use senior care plan, but it's all the same. This presentation will cover how to access resources for senior in New Jersey, Medicare and Medicaid process in New Jersey, home care services, the Veterans Aid and Attendant program, which provides home health care services to veterans who are service connected. And I'm going to explain what the service connectability means and further on in the slide. And it also helps you to, this course will also help you to learn about the QIT account, which is a qualified income trust, which is basically an account that you could open at any bank, and you could make sure that transfer all your income in that account, and it will not count towards the Medicaid eligibility, and I'll explain more further. I'll also talk about the Medicaid HMO. What is a Medicaid HMO? Transportation for seniors, senior primary care services, which is very important to utilize because they're more sensitive to the needs of seniors. And most of the senior outpatient services take adults ages 50 and over, so you don't have to be in a wheelchair or in a nursing home to access senior care services. And we talk about mental health for seniors. We also talk about veterans services for senior veterans. The New Jersey Medicaid is a jointly funded state and federal healthcare program for those with limited financial means, which is basically the eligibility is determined by your income. And for the purpose of this presentation, we're talking about seniors. So in New Jersey, Medicaid for the elderly, which is also called the NJ Family Care, Age Blind Disabled, which is a shortened form of ABD, and you could access the application online through the New Jersey Department of Human Services of Medical Assistant and Healthcare Services. And I will put a link at the end of this presentation where you could access this. And this is where you're going to also be able to access the QIT account, which is also what I mentioned before, a account that you create to relocate your income so that those income does not does not count towards your eligibility. So there are some stipulation though if the person is deceased, which I'll go over further on in the slides. Personal care assistant is a program that is under the PPP program, which is funded by your Medicare HMO, basically your health organization. Say for example, if you have Medicaid and you have an HMO such as Aetna or Horizon NJ, you would get these services from your HMO. So you would speak with your case manager if you are a managed long-term care services patient, and you will get these services. So these services helps with activities of daily living, so you will be able to get an aid from an agency in the home. And if you use the personal PPP, you'll be able to assign a family member or friend, and they'll get paid for taking care of you. And going back to the personal care assistant, you could get services from a home health aid agency where they will send someone out to do like housekeeping, help you with bathing, showering, taking you to the doctor's office. And this is part of the services that this program provides. Preference program is part of the New Jersey Medicaid program where you can assign a family member to help to take care of you and they'll get paid. But bear in mind that they do a background check and they do have their eligibility requirements for those family members as well. Another much needed resource is senior housing. In some states, in some counties, there is a waiting list, especially for Bergen County. I have in this slide some of the places that are currently accepting application. Some have their stipulation, meaning that you have to be a resident from that town, but others are different. So these are some housing that are available in Passaic County. And as you go along, you may see different, some are in Patterson, some are in Passaic, Clifton, New Milford. So you just have to go on the website or you just have to call to see if these places are accepting application. I have some listed for Bergen County, and as you could see, some of them have their stipulation and requirements that, the second one, you have to be an Hasbrook Heights resident. This Emerson Veteran Supportive Services supportive home, you have to be a veteran, so they have their different stipulation. But by all means, you could also go on the website, the Bergen County Housing Authority, to see if they have openings. I know now the waiting list is closed for housing, but these are housing for a senior. And I know the Lehman Garden is a good one if you're in a wheelchair and you're unable to maneuver in like the traditional housing. I think this is a good one for you. These are just some additional senior housing in Passaic County. These are current and up to date because I use these for work, so I spoke to some of the staff that works in the housing authority, and these are some of the housing that they had on the list. These are the most current that they have. And I know Bergen County does have a booklet on their website of different resources, but what I find about that book is the book is not current. Due to COVID, a lot of places, a lot of agencies are not providing the services that are advertised in the book, whether the service has been discontinued because of funding or they no longer provide those extensive services. So you have to call, but these are very current, but you still have to call to see if they have the housing available at the time that you need. These are just some additional, and I know these are in Passaic County as well. They're in Patterson and Passaic, which are all in Passaic County. Good options for senior who lives alone and may be socially isolated. They're also good for seniors who live with family members who work and they may need a break, so they may go to the nursing home. And there are several ways, I'm sorry, not the nursing home, go to the daycare. And there are several ways to pay for daycare. So you could pay for the daycare out of pocket. And also Medicaid, they do have on the Medicaid website, on the New Jersey Human Service website, rather, they do have a list of Medicaid daycare, meaning that Medicaid will cover the cost if the senior is eligible. And Medicaid will only cover these costs if these seniors have Medicaid already or they're eligible and want to apply for Medicaid. So these seniors and these daycare could be social daycare, meaning that the emphasis is on recreational and activities. They may go on trips, they may go to different activities, but they don't have an extensive medical needs. So they do have medical daycare as well, but you could always go on the website, New Jersey Human Service website, and see all of these services that are available. And when we talk about social adult daycare is available under the managed long-term care services. So this is basically a part of a system under Medicaid that if a senior has managed long-term care services, it means that they're eligible for nursing home services, or if they're eligible for nursing home services, they could live at home, which we call aging in place. And also with managed long-term care services, the senior is able to receive respite care. And I think a lot of family members always ask me about respite care. So respite care is what the name suggests. So for example, if you are caring for a family member in the home and you're the primary caregiver and you want to go on a vacation next week, or you just want a break, you just want to be home without the senior, you could place that senior into a nursing home or a senior home where they may stay for those 2 weeks, and you will bring the medications, and it's just like a time away where you get time to regroup and time for yourself, instead of having, leaving them home alone, or having to hire someone to come into the home to care for them. So respite care is a service that is under the Managed Long-Term Care Services, which is the MLTSS. And also there are various agencies that provide resources for senior. So as we go along the other slide, and as you see in this slide, which is a JAC, which is a Jersey Assistant for Community Caregiving, you just have to call your local ADRC, which is the local Aging and Disability Resource Connection, and they will be able to direct you to the local office in that county, depending on where you live, and they'll be able to assess if you qualify for certain services, but you won't know unless you call and participate in the assessment. Common question that I also get is, how do I pay for home care services? And I mentioned before, a lot of times family member will say, oh, I need an aide in the house. She has Medicare, but Medicare does not cover home care services. And I'll tell you the exception where they do, which is kind of tricky. So paying for home care services could be a number of, you could do this a number of ways. So you could pay out of pocket, which is private pay, you pay upfront, or you could use the Veteran Aid and Attendance Services. So that's the VNA services. And how you would get that service, you could go online at va.org and just type in aid and attendant, and you could go online and complete the form and submit all the documents. It'll show you, depending on where you live, where to submit the document. I believe for New Jersey, the submission center is in Pennsylvania, but it's on the website. And you would submit the information. And the easiest way to do so is, if you're a veteran with service connection, you could go on the va.org website and .gov website and check out the eligibility where service connection is concerned, or you could go to your PAC team, which is the patient aligned care team, which in the VA they call it primary care. So even if you have a primary care doctor or primary care practice that you attend in the community, you still can go to the VA, just so that you could go to them for referral for services that are service connected. Say for example, if you're established with a primary care provider in the VA system, and you could just go to the primary care, let them know that you need a home health aide there, and they'll put in a consult for you, and someone from that department will call you, do an assessment to see if you are eligible. And I think that's the easiest way versus completing online, because sometimes there are some things that are unclear, and it's much easier when you have someone from the department guiding you. So I always encourage the veterans, please establish care with the VA. Even if you have a primary care in the community, say you have a primary care at Hackensack Hospital, a primary care at Robert Wood Johnson, please establish care with the VA, because they are able to provide referrals that your doctor at Hackensack will not be able to provide through the VA system directly. Also, another way of paying for home care service is through Medicare, which I remember I told you Medicare doesn't cover home care costs. The only exception is for skilled services. And what do I mean by skilled services? Say for example, mom broke her hip and she went to the hospital. So that's a skill they're caring for. Or if she had a wound and she's receiving wound care and she's getting discharged, so they'll discharge her with home care services. So someone will come out to the home within 24 to 48 hours after mom has been discharged from the hospital. They'll do an assessment to see how many hours she may need. And what I always tell family, she'll not get 20 hours or 50 hours. She'll just get whatever she's needed at that time is needed at that time, and it's very short term. It may be for a couple of weeks, but it's not a long-term plan. And they will not do the services that the Medicare home health aide will do. So they'll do stuff like dress the wound, help you around the house, and a nurse will come out to do medication management, help with the medication. You'll receive, if needed, be physical therapy in the home, occupational therapy, speech therapy. So those are what we call skilled services. So in terms of skill services is different from auxiliary services such as, someone for companionship. But also when you receive Medicaid services or Medicaid home health aid, it can't be just for someone to clean the house. That cannot be the sole purpose. It has to have like a skill, like mom needs care. And another one is long-term care insurance. So this insurance, for say for example, mom is 45 or 50, she could have that insurance in place even though she may not need it then, but she could pay into it, and that can help to cover home care costs when she needs that. And also, when we talk, going back to veteran services, like a spouse of a certain type of veteran, which all of this information is on the website, va.org website. The spouse, say dad served in the military and he passed. Mom, if dad was eligible for service connection services, that mom would be able to receive services through the VA aid and attendant. The QIT is an account that Medicaid recipient transfer their income into in order to be eligible for Medicaid, and this does not count towards the Medicaid eligibility. So for Medicaid, you can't have no more than $2,000. So the resource limit is $2,000 cash. You can have a house. However, if you have a QIT and you have Medicaid, when the house sells, depending on the county, they'll work everything out for you and they'll tell you what goes back to the government. So the income limit is $2,000. So if your income is over $2,523 and you have Medicaid, then you would need a QIT account. So for the QIT, you would go to the newjersey.gov for the QIT template, and I also have it here. So just a little way how to fill it out. On page one, you'd have the grantor, which is the senior's name. Then you will have on page two, you won't fill that out. So on page two, that's nothing. On page three, you will have the trustee information, the successor trustee, meaning that if the trustee that is assigned is not able to sign, then you have a successor. And then on page four, down at the bottom of the QIT account, there is any money left in the QIT. Who will that go to when the state is paid back? Remember when I talk about having a house, when you sell that house, when the person dies, the owner of the QIT account, the state is paid back or what they paid for in all medical expenses. And when you have a QIT account, you don't have to be in a nursing home. You could also live in the home, aging in place, meaning you have someone taking care of you, and providing nursing home services or home care services for you. So you both could live in an institution and you can have live at home, and you will receive a stipend or an allowance out of your QIT account, which is $2,553 per month. So if you get a pension, if you get any other income like cash on hand, that will go into the QIT account. So the QIT account is basically, you can go to any bank, your bank or a different bank with a QIT form, have it notarized at the bank, or you could have it notarized beforehand. The bank doesn't have anything to do with the account. You will go to the bank and they'll create the account for you, and you will just need proof that the account is created, and you would upload that to the ABD, which is the Aged and Blind application, which is found at the newjersey.gov human service website page, and you would complete the application and upload that that form, that the account was open, to the website. And then you could call the county, like for Bergen County you could call Rochelle Park, and if you're not tech savvy, you could bring the application in and they'll tell you where to drop it in the drop box. I'm not sure if they're accepting people in person right now. But that is how you go with the QIT account. And I have another video coming just giving a demonstration on how to complete the QIT and more information, because I think it's kind of confusing because people always ask, what is a QIT account and how do you go about establishing it? Do you need a lawyer? No, you don't. You could do it on your own for your family, and anyone can do it. A social worker can do it for you. You could do it for yourself. As it relates to elder care planning, long-term care insurance is another way of paying for home care assistance, such as having a home health aide. You could go to occupational therapy, you could go to physical therapy, it could pay for medical services, but it does cover home care services for home care services for people who are incontinent, like if you need services and support with activities of daily living, that insurance will cover that. And most people receive long-term care insurance through their job or their spouse's job, or they could take out a standalone plan and pay into it, and they could use that towards home care services further down in the year. So as I mentioned before, elder care or senior care planning is not for people who are nursing home eligible, but the plan does need to take place long before they need it in order to reduce stress and maximize all the services and benefits. Let's talk about Medicare. A lot of people believe that Medicare will pay for home care services, when in the reality, these type of Medicare plan only provide some reimbursement for intermittent visit for home care nurses on a temporary medical diagnosis. As I mentioned before, like a wound care, a broken hip, like help that person to recuperate. However, when we talk about Medicare, a lot of people are aware of Medicare. Medicare will pay for your hospital visit, and the plan that comes automatically, meaning that you don't have to sign up for it, is Medicare Part A. So sometimes you'll Medicare Part B. For some people, they don't have to sign up for it though. It will automatically come from their job, but you do have to. Most people do have to sign up for Part B, but Part A, no. And so Medicare basically cover in health insurance doctor visits, specialists, and you are recommended or encouraged to do a yearly wellness check. That's basically, it helps your case management to track any changes. It's for utilization purposes and case management purposes. And in order for you to receive services, home care services through Medicare, your doctor has to certify that you need these services. And it's essentially, if you're in the hospital, the doctor is saying that, this person needs this services. We're going to talk about the veteran services. A lot of times, what I've seen, a lot of veterans that come to the geriatric practice outpatient, they're not aware of the services that they have. And in order to receive care from the VA, while you could do a walk-in to the VA, but it's good for them to coordinate your care when you registered with the VA. So what I mean by that, so the VA has small clinics that they call C-box. So this is basically small outpatient clinics. They have in and around New Jersey and other state, but for the purpose of this presentation, I'm talking about New Jersey because laws are different in different states. So, and the closest one we have is up north. We have East Orange. You could go and establish care at the primary care facility, meaning that you go, you register, you provide your name and all the information that they request. And if you don't have the documents, they could help you to find those documents, because I know that's like a common topic and a common theme with a lot of the families that I speak with. Oh, I don't know where to find the DD 214. they could help you to find that, and family members can navigate the website to find old records of deceased veterans if they're looking for services for the spouse. Also, going back to, I can't stress enough, established care with a primary care provider. So it's called the PAC team, which is a patient aligned care team. They all your services are centralized through them. So if you want a behavioral health, if you want behavioral health services such as a psychiatrist, you go to your PAC team, your primary care, and they'll put in what is called a consult. If you want home and attendant, if you're a homeless veteran and you need services, once you meet the requirement for service connectivity. So for example, if you're 100% connectivity, you cannot get housing because you already are being paid. So they expect you to be able to manage your income where you could afford housing. And if you cannot, then they have additional services, case management services to help you do so, and assign a fiduciary, which is a whole different type of topic, but I don't want to confuse. I just wanted to stay on track about the services that veterans can receive for senior care services. So establishing care with a primary care provider, even if you have a provider in the community, a regular provider, that's fine, because if you want veteran services, that provider cannot say, okay, let me write a script. You know what we always do in the community, write a script for home care services. They cannot do that. It has to come from, they may be able to call to advocate for services, but you still have to go through the VA channel to do so. As a mental health provider, I'm just going to throw this out there. If you know a veteran or someone who may experience crisis, or, just any veteran, there's this veteran crisis line number that they could call. When calling that, talking to the caring and compassionate workers on the line, they could also connect them to services, may not be directly, but reach out to a provider in the catchment area, or if you're already established with someone, they could reach out to your provider. So there's a veteran crisis line. The number has changed, making it easier for you to remember. So it's just 188 and press 1. So it's not the long number anymore. So if you're in crisis, you need somebody to talk to, you can't get access to your primary care doctor or your physician or psychiatrist, you could go. But you could call that number. So for the purpose of this, they have support services, which is called the aid and attendance. So if you're a veteran or a surviving spouse of a veteran, you may, and this is keyword, you may, because not everybody's case is the same. While you may serve in the same war or the same time, wartime, you may not be eligible for services that the other person is eligible for. It's based on your connection, the type of war you served in. Everyone is different, because this person may have this 100% connection based on different disability, and the connectivity is based on disability. So this person may have 10% based on PTSD, 20% based on leg, 10% based on military sexual trauma. So it varies. So this person may be able to receive services, and if that person is not, who served in the military, is not alive anymore, their spouse can get that. And I cannot tell you how many times when I work in outpatient, these services are very underutilized. I think sometimes because people are not aware of the services, and sometimes they may not be able to find the documents because they have served such a long time ago. But these shouldn't be a deterrent for you not to receive the services that you deserve. So the program is called the Aid and Attendant Program, and they also have the Caregiving Support Program as well that support caregivers. So if you are a family member that is providing services to a veteran, like go to the VA and inquire about the services that you may be qualified. Talk about community resources, and this is where things get a little tricky and you have to be very creative. So I have been asked a lot, where can I get this type of resources for that type of person? But you could go on the website for each county. They do have a number of resources, and I know because of COVID, some of these resources that they had in the past doesn't provide the comprehensive services that you may need. However, these agencies do have something for everyone based on your eligibility, but you have to call, and yes, you have to endure the long wait. But in order to avoid some wait time, you have to call the local agency. So, for example, I'm going to talk about a few agency statewide agency, but they have their local catchment area, meaning the places that they service. So if it's a Bergen County, so if it's a Bergen County agency, you may be able to call them. They'll serve the lower Bergen County or the upper Bergen County, so they'll be able to direct you to the right agency to call in a sense. The Aging and Disability Resource Connection is practically a lead agency in all 21 counties. So we do have them in all counties in New Jersey, and they do ensure seniors and adult with disabilities and their caregiver have access to information about long-term services. So long-term services in this sense means services that the senior will need throughout their illness, throughout their caregiving needs. So maybe end of life. So the ADRC for short is basically the point of entry where the first one you would call for services for people with disability and for seniors. And they assist seniors and their caregiver, meaning the people who take care of them. It could be family, it could be professional caregiving from an agency, and they provide guidance to all the resources. So they're going to tell you about the resources that are in your area that you qualify for. They're going to do a telephone assessment with you, ask you a bunch of questions, and they'll be able to direct you to the local agency because they are the point of entry, and they'll tell you what agency based on the question that you've answered in the assessment that you could contact. So a few community services, the PACE. This program is a Medicare program, and it provides services for individuals 55 years and older, basically comprehensive medical and social services in a coordinated manner. And they use an interdisciplinary team, meaning that they'll have a social worker, a doctor, they'll have occupational therapists, and those type of services they'll provide in a comprehensive manner in the home. And this service is for people who want to age in place, meaning you don't want to go to a nursing home. You want to receive all the care, provided that all the care can be provided at home. So it's for people who, and this service is save the government money because it delays nursing home placement. So if you don't have to go into the nursing home, these services can be provided at home for you. And also the JAC program, which is a Jersey Assistant for Community Caregiving. It's a state-funded program, and it provides services such as similar to the Medicare the PACE program. And it's basically if you do not qualify for Medicaid, which is the income eligibility program, which is state and federally funded. If you do not qualify for that, you could apply for the Jersey Assistant Community Caregiving Program, and you pay based on your income. And the assessor or the screener will tell you give you a better idea of what you would pay based on your enrollment in the program. And it's for individuals who are 60 years and older, and you must have a clinical eligibility, meaning that maybe not just that you're frail, but you are clinically eligible, meaning that you need someone at home to care for you. Maybe you have like a disability, like that you need someone to care for you, cannot be at home by yourself. And it's basically help you to remain in the home for as long as you can. So all these programs that are on this slide basically does that. And also another program in the community that I think some people take this for granted. They don't see the necessity of it, but the Meals on Wheels. And I know the most reaction I got from telling people about it, the meals are not good. But one thing about the Meals on Wheels program, which is a nutritional program in all 21 counties, they do offer this. So for so you would apply for this, and while it's free, they do encourage like a donation, but it's not necessary. So if you have a senior that live home alone and you live in another state, the beauty about the Meals on Wheels program is they have if they deliver the meal today, tomorrow, and the next day, and they do not see the senior come to the door, they'll definitely call the Board of Social Service and they'll do a wellness check. And on top of the wellness check, I had a senior who lived at home, and while I was working outpatient, I signed her up for the wellness check. So basically they'll take your number and they'll call you at a certain time. So if, for example, if they call you 5 o'clock every day and they do not they always get you on the phone, and 2 days in a row or a day in a row they call and they did not get you, they'll send the police to your home. And they did just that for my client that I had in the past, and she was at home on the floor. She didn't have a life alert, so that program was helpful for her because her family lives out of state, and through the wellness check program it helps her, from having um a terrible outcome than what it was when it happened. For the second half of this slide, I'll talk about insurance, specifically Medicaid, Medicare, and long-term insurance. And I'll cover what is covered under each insurance and how to apply for which.